Hello, I am your host Jasmine Ovalas and welcome to the Medcast Plus show. On the show, I will feature local community physicians who are experts in their respective fields and who will share their experiences and wisdom so we as a community can become an area of powerful influence and betterment. I invite you to get involved as a community so we can all become more educated and more tightly connected to make a difference. We are here with Dr. Maurice Mosseri, one of the country's top eye specialists and surgeons. Doctor, welcome to the show.
Thank you for your kind words, and thanks for having me, Jasmine.
Hey, doctor, may I ask you, what made you get interested into the medical field?
It's funny that you asked that, and I was talking to my mother about it, how simple things that happen early in your life have a big influence on you. And when I was a little kid, we had a wonderful pediatrician who was very caring, and my mother and father would always say how kind he was, how caring he was, how much he helped everyone in our family and the community. And I thought to myself, yeah, that's what I want to do also. We used to watch television shows, Marcus Welby, MD, and of course medicine has changed a lot since then, but the basics have stayed the same, which is really just providing caring help to people.
That's sweet. Tell me a little bit more about your professional background.
So with that in mind, I went to medical school. I went to Albert Einstein College of Medicine, which is a fantastic, great medical school that not only taught you the basics of being a doctor, the surgical stuff, the medical knowledge, but also really focused on a humanistic approach. So taking the person as a whole and taking care of them in that way. And at Albert Einstein, I was exposed to some people that got me interested in ophthalmology. I really respected a few people that also had that same approach of being excellent at what they did, but also really bonded with patients as people. So after that, I was very fortunate to have the opportunity to go to San Francisco and do a fantastic ophthalmology residency program there. And we did just tremendous training in surgery, and again, just tremendous training in surgery and taking care of patients. And over there were some mentors, and the chairman of the program was a glaucoma specialist, and I just loved how he related to patients and really took care of them as people as well as being an excellent surgeon. Oh. And after that, I got selected to do the glaucoma fellowship at New York Eye and Ear Infirmary, and that's considered one of the world's best glaucoma fellowship training programs, where we just did for a solid year glaucoma surgery and taking care of complex problems that were referred from all over the world.
Really? Well, congratulations, because now you yourself are considered an expert in glaucoma.
Thank you.
Can you explain to the viewers exactly what glaucoma is?
So glaucoma is a disease of the optic nerve. And what that means is that the nerve that connects the eye to the brain gets damaged in a certain way. To understand that, we have to really understand how the eye works. And basically, the eye is like a video camera, similar to what we have here in the studio. And there's lenses that focus the image from the video to the back of the eye. There's film, or nowadays photoreceptors, that capture the images, and then it sends it to the brain through a cable called the optic nerve. When that cable gets damaged, that's called glaucoma. And most of the time, but not always, the eye pressure inside the eye is high, and that causes damage to the nerve. A common misconception is that people think that only high eye pressure is needed to diagnose glaucoma, and that's not really true.
Okay. A person with glaucoma, how would they notice? Do they feel something? They see something different?
That's an excellent question. Glaucoma has been called the silent thief of vision.
Really?
And yes, and the reason for that is many people don't have any symptoms at all. They don't notice anything, they don't realize anything is wrong until the disease is very, very advanced. And at that point, that's when they notice it. So it's really, really important to detect glaucoma early before the person notices that they have a problem. And as I was saying earlier, people sometimes mistakenly just look toward eye pressure as being the only thing that you have to use to detect glaucoma. That's not true. There are many other things that we have to look at in order to diagnose glaucoma.
What are some tests that you can use to detect glaucoma?
So one of the very important tests is something called a computerized automated visual field. That's a special type of machine that's similar to a video game that tests your side vision. I mean, we don't really want to wait until you can't see a car coming or a truck before we diagnose the disease. So we use special equipment that we have in our office to diagnose early changes of the loss of peripheral vision. We also have very sophisticated types of imaging systems which take special types of pictures of the nerve in the back of the eye and are able to see if you've lost any of the one of the million fibers, the millions of fibers that go in that make up the nerve. If you've lost some of them, we could detect that with some special images. So those all come together to help us diagnose glaucoma.
Okay. And if someone with glaucoma doomed to become blind, are there any treatments for it?
So a lot of times people hear the word glaucoma and they get frightened. Oh my God, I have glaucoma, I'm gonna go blind. And that's, fortunately, that's not true. If we detect it early, really, we can stop it dead in its tracks and the person won't ever notice that they even have a problem. There are three major ways that we treat glaucoma. The most common way and the simplest way is using eye drops. So we have eye drop medicines that a person puts in their eye that lowers the eye pressure and treats the glaucoma. Sometimes we can use also a laser, and that laser can also treat the glaucoma. And for more advanced cases, we actually have surgery that we do where we make a new drain for the eye, and that also will lower the pressure and prevent the glaucoma damage from getting worse.
Are there any new treatments for glaucoma?
Absolutely. One of the newest things that has come around has been something called minimally invasive glaucoma surgery, otherwise known as MIGS. And that's a type of procedure where instead of doing the full-blown glaucoma surgery that we do for advanced cases, we can do a type of procedure that's minimally invasive, and that's done for early to moderate glaucomas. That is a very safe procedure to do, and that lowers the pressure. Also coming down the pipeline are some implants that you could put on the lid that will slowly release medicine for, let's say, 3 months, so the person doesn't have to keep putting drops in their eye constantly.
Well, in addition to glaucoma, you're considered a cataract surgeon, an expert cataract surgeon. Are they related? What is cataract?
So that's a very good point. The cataract and glaucoma are really different types of diseases, whereas glaucoma is something that is silent, where a person doesn't really know that they have it. A cataract is something that a person does notice that they have. They may notice that they have trouble driving. They may notice they have trouble watching TV, reading even with their glasses. They may have glare, or they may notice that the room just seems darker than what other people are noticing and they have to turn up the lights. A lot of people with glaucoma have very advanced cataracts. So when we do glaucoma surgery, we also have to deal with very advanced cataracts and very complicated cases. Most people, of course, don't have complicated cataracts. They just have simple cataracts. Now, what is a cataract? A cataract is a clouded lens that's inside the eye. If we think of the eye as the camera, there's a lens that focuses the pictures, and that lens with age gets clouded, and that is called a cataract.
Are there any advances in cataract surgery?
Absolutely. Many, many years ago, when I first started doing cataract surgery, we used to make very big cuts on the eye and had to put a lot of stitches in there and would take out the cataract in one whole piece. But with the advances in technology, right now it's very different. What we do is we make a very small incision and we use a sound wave probe that breaks the cataract up, and then we suck it out like a vacuum. And we don't use stitches afterwards. So the person has a very, very quick recovery. We also put an implant into the eye, and because the opening that we make to take the cataract out is so small, the implant is a soft implant, and we have to fold it, put it in the eye, and then unfold it inside the eye. And those are some of the newer advances in the cataract surgery.
You mentioned implants. Are there any types of implants? What exactly is an implant?
Okay. A lot of times people hear the word implant and they don't know what we're talking about. So an implant, when we take the cataract out, the cataract, as I said, is a lens, and the lens is focusing the pictures. Well, if you just took the cataract out, the person would be looking at the world and they wouldn't be able to see clearly because nothing would be in focus. So what we do is we put an implant inside the eye. The implant, as I said, is made of a very soft material. It's called acrylic. And you fold it, you put it into the eye, and then you unfold it in the eye, and then it stays there forever, and it focuses the pictures. Now, there's the standard implant, which I just described, and there's also implants nowadays that can treat other conditions. For example, some people have something called astigmatism. Astigmatism is something that the eye has where the pictures become distorted when they're looking at the world. So we have implants now that can correct that astigmatism. Those are called toric implants. Also, we have newer implants that can correct for far and for near. With the standard implant, when we put that in, you can correct the person so they could see TV well, but they may have trouble reading and need glasses for reading. With these newer implants, they can read and watch TV with a minimal need for glasses, or sometimes even no glasses at all.
Okay. Very interesting. What can a person undergoing cataract surgery expect?
So cataract surgery nowadays is very pleasant for the patient, as pleasant as surgery can be. People come to the surgery center. The technicians will put some eye drops in their eye. Of course, most people are a little bit nervous when they have cataract surgery, so the anesthesiologist will give them some medicine, something like a Valium, to relax them. But there's no tubes put in their throat, and there's no general anesthesia. It's all done with local numbing medicine so that the eye is numb. I do the procedure. It takes less than 10 minutes. The person is awake during that procedure. Afterwards, they go home. They can do their normal activities. They don't have to be in bed. And the recovery from that is very, very quick in terms of how they see. They see better almost right away.
Okay. Well, other than cataract surgeries and glaucoma, are there any other common eye treatments you do?
One of the most common things that we see because of the population getting older is dry eye. It's a very, very common thing. It's very common in people with glaucoma. It's very common as people get older. Women over 40 are very prone to get dry eye too. So dry eye is a very common problem. The simplest treatment for that is, of course, just lubricating drops, artificial tears. But nowadays we have special implants that we could put on the lid that help keep the tears around longer so that the person feels a lot better for most of the day. That's a really nice advance because there's really no side effects from it. It's a very safe procedure and people do very well with that.
Interesting. Are there any other guidelines regarding eye exams?
So the general guideline is that if you are a person who has no medical problems, no family history of any eye diseases, then you should have an eye exam when you're 40 years old. Certain populations are at higher risk for developing glaucoma. For example, African Americans, Hispanic people are much more at risk for developing glaucoma, and they should have a baseline exam when they're an adult. For everybody else, it's really beginning age 40. If you have a family history of glaucoma, then you should, of course, get an exam when you're an adult. And after that, usually once a year, a person should be examined for general eye health.
Doctor, do you practice in a hospital or do you have your own private practice?
I have my own private practice. I always like the idea of having control of how patients are cared for, and I was never one to want to get involved with a big organization. So many years ago, over 20 years ago, we started our own private practice.
So we as in you have a partner, or
Yes.
do you have your own thing going on?
No, I have a partner, and it's actually interesting. David Pinhas, he and I have been friends from before first grade. We were friends in the playground. Our parents were friends. Our grandparents were friends. We went to elementary school together, high school together, medical school together, and we actually did the same fellowship in glaucoma at different times. I had taken some time off to do some research and travel. But so we've been friends for over 48 years now. So it's been a long time. It's like almost like a marriage.
When a patient comes to your office, what are they most afraid of?
Without a doubt, people are afraid that they're going to go blind. And I tell the staff all the time, and my partner does too, we remind everyone that when people come in, oftentimes they're frightened. They've been told that they have glaucoma. We have a lot of patients that get referred to us by other eye specialists, specifically for glaucoma. And they come in and they're frightened. They don't know what it all means. Are they going to go blind? Are they going to need a dog or a cane? And they're very frightened. So our first job is to figure out where they are in the disease and make sure that we let them know that they're not going to go blind, if indeed they're not going to go blind. And most people are not going to go blind.
So
actually.
if somebody was to go blind, how would you break that news to them as a doctor, trying to make them feel better about what they're about to go through?
Most of the time, a person who is going to go blind from a disease, it occurs because something messed up along the way. Either they weren't diagnosed properly, or for whatever reason they didn't attend to their problems. You know, a lot of us are busy with things in our lives, and we neglect things. And when that happens, a person can go blind from glaucoma. Most people, however, do not go blind from glaucoma if they're caught early. The people that we see that are blind from glaucoma, it's usually because they were diagnosed very, very late in the disease for whatever reason, or they didn't follow with the treatment plan. And that's usually the people that we see that come to our office that are really already blind from glaucoma.
Interesting. Okay, doctor, what are your final words to the audience? What would you like to leave us with?
I would say the most important thing is take charge of your health. Make sure that you ask questions. Make sure that you know if you have glaucoma, make sure that you know what your intraocular pressure is. Make sure that you know how your visual field looks. If you can get copies of your records. Nowadays it's a little less vital because everything is stored electronically, so even records from 20 years ago will be available. But you should definitely stay on top of your health care, and don't be afraid to ask questions. Any good doctor will take the time and answer your questions and make sure that you feel comfortable knowing what's going on with your health.
Okay. Just to follow up, what questions should these patients be asking their doctors?
Specifically with the eyes, they should ask, do I have glaucoma? What stage is it? Is it early, middle, or late stage? That's a very important question. What is my eye pressure? What is the highest that my eye pressure has been? Another common thing is, how do I use my medications? A lot of times we prescribe medicines to people, and we of course explain how to use them, and then the person is embarrassed to say that they can't get the drop in their eye because they have arthritis, or they are having difficulty getting the medicine in their eye. So I will often ask people when I suspect that, and I'll tell them, don't be embarrassed to tell me. If you can't get the drop in the eye, it doesn't help that I'm sending the prescription to your pharmacy. We need to make sure that you're able to get the medicine, and if not, there are other options. As we mentioned, there's laser and there's surgery that can be done for people.
Hey, doctor, you mentioned arthritis and people not being able to do certain things. About what age would people with glaucoma get it? Is it usually more older, or maybe younger kids get it too? It's like towards what age range?
That's an excellent question. Anybody can get glaucoma at any age. There's childhood glaucomas, teenage glaucomas, but most people who get glaucoma are older. As you get older, the incidence of glaucoma increases dramatically. Right now in the United States, there's almost 3 million people with glaucoma, and most of them are people over 60. So that's the common age range. There are certain groups of people that tend to get glaucoma at much younger ages. For example, people who are African American from the Caribbean islands tend to be, unfortunately, suffer from glaucoma at a very early age. There'll be people that come in that are in their 20s, and they'll have advanced glaucoma with very, very high eye pressures. So if you're in that category, you should definitely be screened and checked. And we do tell our patients, and we have quite a few patients from the Caribbean, some who fly up from there, and others who live here, who have relatives in the Caribbean. We tell them that their relatives should be checked even in their teens and early 20s. That's a very common thing that we see, and it's a very sad thing.
What's the connection between glaucoma and the Caribbean? What about the Caribbean makes somebody more prone to get glaucoma?
We really don't know. It's probably something genetic. There's some genetic predispositions. Different groups have predispositions for different types of glaucoma. In the group of people that are in the Caribbean, it tends to be something called open-angle glaucoma. Patients who are Russian background, for example, and there's quite a large population of patients like that here in Brooklyn. They tend to have something called exfoliation glaucoma, which is a different type of glaucoma, and that's probably either genetically transmitted or something called a slow virus transmission. Asian patients tend to have something called angle closure glaucoma, which is a different type of glaucoma that's treated early on with a laser as the first step. So different groups have different dispositions for different diseases.
Interesting. Can you explain in more depth what is the difference? What is like the difference between different types of glaucoma?
Okay, and that's an excellent question. There's two big categories of glaucoma. One is called open-angle glaucoma, and the other is closed-angle glaucoma. When we talk about glaucoma, we're talking about how the fluid in the eye circulates and leaves the eye. And in some people, there's a blockage. The blockage could either be on the inside of the drains. If you think of a sink, you can have a blockage in the pipes of the sink, or you can have a blockage on top of the drain. That's called angle closure glaucoma. So there's different types of glaucomas. People with exfoliation glaucoma have a protein material that looks like little tiny dots inside the eye, and those protein materials clog up the drains inside. It's as if you were pouring rice down your sink drain, and that would clog up the drain, and that would cause everything to back up and build up the pressure inside the eye and cause damage to the nerve in the back of the eye. So those are the basic different types of glaucoma.
Okay, thank you, doctor. What has been one of the most serious cases of eye treatments that you've ever treated in your practice? What was the most serious, and how did it get to that point that you were like, wow, this is bad?
We were just talking about that, my partner and I. We had, I don't know, it was maybe the most dramatic. We had a patient who was referred to us, and he was a professor of literature at Columbia University. and he had a terrible cataracts in both eyes, and was unable to read, which is what he loved to do. And he was told by someone that there was nothing that can be done because of his diabetes, and he was otherwise not a healthy man, but mentally he was very healthy, and he wanted to read, and he was told nothing could be done. So he suffered for almost 5 years of not being able to see or read or watch TV. And somehow he got referred to me, and he came in, and I said, that I thought that there was something that we could do. And I told him that, and he said, let's go for it. And I did the cataract surgery, and it was a complicated type of situation, but it went very, very well. And the next day, he was in the office, and he's in his wheelchair, and he's crying. And I looked at him, and I said, are you okay? I thought something was wrong. And he says, nothing is wrong. He said, I can finally see. And he said, I can read, I can see. He goes, it's like my life has been given back to me. The funny thing is, he had been seen at a university prior to that with a professor there, and I was joking around with him, and I said, do you want to go to this professor and tell him that, I operated on you?
Yeah.
And then this is what happened. He said, if I ever see that man again, I'll kill him, because I suffered for 5 years, and they told me nothing could be done. So that was the most dramatic case, and I ended up operating on his other eye, and he was very happy and lived out his days being able to read, which was very important to him.
So how does that make you feel as a doctor, knowing that you were able to change somebody's life that way?
It makes you feel great. It's the reason you go into this field. It's one of the wonderful things about ophthalmology is that you really can give people back their vision. And most people feel that their vision is the most important sense that they have, and without it they feel depressed, and with it they feel happy.
Okay, well, Doctor, thank you for your interest in the show, and thank you for being here and answering the questions. And as for the audience, thank you for your interest in the show and your desire to become involved and educated. I invite you to visit our website at www.medcastplus.com and check out our tools and connect with us on social media. You can also call us at 718-510-2103. Please stay well and be safe. Goodbye.